Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Valley Health Minutes. If you're not ready to have a baby, contraception is probably on your mind, and it's a conversation you need to have with your doctor. So today we're talking with Dr. Kuhl about the different types of contraception and how you can figure out what is right for you and when is right for you. So let's talk about the common forms that are available.
If patients just want to do something that is a little more temporary, if they're not certain how long it may be for them to delay pregnancy, usually they can use something such as condoms or vaginal suppositories or some other over-the-counter options for treatment. But if it is something that they want, perhaps something that is more reliable, because those other options that I first mentioned don't have great prevention rates in comparison to other long-acting contraception. In terms of reliability and what a lot of patients opt to use, oral contraceptives or the birth control pill is a great option for patients if they are a reasonable candidate without other complicating factors in their medical history that might prevent them from using something hormonal. In addition to oral contraceptives, there are combined contraceptives that come in the form of a vaginal ring or a patch. There are progesterone-only long-acting contraception that can be used in the form of a shot every 3 months or an arm implant that's good for 3 years. There just recently was released an over-the-counter oral contraceptive that is progesterone only, and the American College of OBGYN has supported its release for over-the-counter purchase that does not require a prescription for this oral contraceptive that is progesterone only, and the reliability in the data, the safety on it is actually quite good.
So these are all conversations. Which type is right for you?
Yeah, there are a lot of options.
There are a lot of options, and you did mention, maybe there's a health concern that would rule you out for this one, but there would be another one available. So let's talk about what are some of the things that would come into consideration in picking the right one for you. Health concern was one.
Sure. With combination oral contraceptives that do contain hormones, if there is a strong family history of blood clot or certain types of cancers, certain types of anatomy issues that might be present with a certain patient, then these are all things that we need to take into consideration to really fine-tune what may be the right option for that particular patient.
Oftentimes people want to have babies later on. They're not ready right now. And then they worry that maybe taking contraception could lead to infertility. Is that a myth or a concern?
So it is a common misconception that there are certain types of birth control that either can lead to an increased risk of infertility or of miscarriage, and that should also be discussed with your physician or your provider, because a lot of the information out there is completely inaccurate. If a patient uses a certain type of birth control, there may be a delay in ovulation with certain forms of birth control that can be discussed with your physician or your provider as well, if that is of a concern, that pregnancy would be desired sooner than later.
Are there possible side effects to contraception?
Yes, and it just really depends on what type a patient would elect to use. With, for example, birth control pills, there may be some mood changes or headaches or other issues that may be of concern. We didn't mention intrauterine devices or IUDs. These are long-acting reversible contraceptives, but certainly some people may have some side effects as a result of the use of IUDs. Although in general, women do quite well with that type of contraception, and it is reversible and does not increase risk for difficulties with obtaining pregnancy down the road.
And not all side effects are bad. Some people choose birth control for maybe acne control when in their teenagers.
Sure. The, acne and cycle control, it can help prevent anemia in young women or in women in general who have heavy bleeding. There is data that supports that the risk of ovarian cancer does go down after a certain number of years of use of an oral contraceptive, so that's very beneficial. So certainly there are very beneficial beneficial side effects to using certain types of contraception in addition to prevention of pregnancy.
Right, but great information to have a conversation, an in-depth one with your physician and figure out what the right direction is for you.
Right.
Dr. Kuhl, thanks so much.
Thank you.
Always great to see you.
Thank you.
Yeah, thanks for being here for Valley Health Minutes. I'll see you next Monday.